to the infamous healthcare reform. And the question simply is, what are the implications for the state of Washington in the implementation of the Affordable Health Care Act? I think we started with Fred last time, so we go to the
They're vast. We have two different bills that we're now trying to put together. We have 2,000 pages where people don't really know what's in there, and we're going to take the time to find out. So how is it going to impact businesses? Well, that's uncertainty. How is it going to help, or how is it going to impact the citizens? Well, we've been promised that you can keep your insurance. Well, if it's cheaper for your business to pay the fine, then they're going to pay the fine, and you're going to be in the quagmire of finding new insurance for yourself. So that promise is going to affect each and every citizen in the United States and every single citizen here in Washington State. Some of them, their employers will choose to pay that and they'll get bumped into the system. Well, that's not right. So what about doctors? Even before this healthcare law was passed, doctors were taking less Medicaid patients. Some doctors now are not even taking new Medicaid patients because they don't get a significant return. So I think that it's impacting the doctors, the service, the citizens, and the businesses.
Well, as the only candidate up here who has and does run a business, let me tell you what the system before did to me. When I started in my stores, I paid 100% of our employees' health care coverage and 50% of their dependents. By the time I was through at the end of 10 years, I was only able to pay 30% of their health care coverage because of the employees' health care coverage and none of the dependents' coverage because of the ever-increasing problems of health care. Those problems aren't going to go away. I don't know if Obamacare is going to work or not, but I know that the existing system before it happened was absolutely unsustainable for any small business.
Great, thank you. So moving from healthcare on to education. How would you fund excellence in education? How can, and the second follow-up on that, on the same part is, how can less fortunate students achieve the same level of education?
Well, the frustration with how we fund education, in fact, our whole philosophy of education, is what got me involved in this legislative race to begin with. I served 9 years on our school board and also served on our community college foundation board. So it's something that is a deep concern to me. And it's also, I think, the one thing that I think that stands out most during my one session of legislation that I've been singularly unable to have a major dent on. I think we have to stop going with periodic fads in education that I've seen over my last 20 or 30 years. That something's repackaged and called something new, and the educational establishment gets all excited about it, but it's really the same idea that happened 20 or 30 years ago. I'm glad that we did eliminate the WASL because I think in our emphasis on it, we had reduced emphasis on some other really important things like history, geography, social studies, which weren't tested and therefore weren't taught.
Would you read the question again?
Yes. How would you fund excellence in education, and how can less fortunate students achieve the same level of education?
K through 12 for 2008 and 2009 got $9.9 billion. I don't think the issue is funding. I think education has plenty of money. They need to make it work. I bet you in here, every single business owner, every single businessman, businesswoman could run the education at half the cost and come up with better results. The money is there. They need to use the money better. Is it an issue of curriculum? Yes. I don't believe that they're taught the basics, reading, writing, and math. I saw a little teeny book about this big, about this thick, that was kindergarten through 8th grade from the 1930s, and it had huge problems of math, but it was the whole entire book. So as my opponent said, the curriculum has been repackaged, redesigned, and we need to get back to teaching the basics. And it's just how it needs to be. The money is there. They need to make it work.
All right, so I think we're getting down to one of our last questions here, and I'm kind of making a choice here. I think I'll go with one of our participants asked a question. What will you do to reduce Washington state government's overregulation on insurances, government businesses, insurances, businesses, particularly health insurance?
The problem with health insurance is overregulation. What do we need here for Washington State Healthcare? We need a consumer-driven healthcare system where you, like going to the grocery store, put in your cart the things that are going to work for you. If you want a streamlined plan and you only want to buy catastrophic care, then that's what you buy. So you can buy the plan that works for you and your family. There's over 50 mandates right now for healthcare insurance, so most of us are paying for things we don't even need. So if we can streamline that process, if we can get rid of some of the redundant regulations and mandates, we can actually make it easier for businesses to do business, for healthcare to be more affordable, and we can lower costs for everybody.
Actually, in general, on that issue, I don't think we have that big a disagreement on it, but it's not quite as easy as my opponent would have all of us believe. That some of those mandates are put in, like breast care coverage and stuff for real legitimate public policy reasons. And the devil in this issue is in the details, as it is in so many other issues in government. And you have to look at each one of those things. But on a philosophical standpoint, I believe you should be able to purchase what you want, not what somebody else tells you they think you need, as a general point, with some exceptions, which are overall policy kinds of things which are good for the public generally, and which, if you don't have it in the insurance policy, the government, the people are going to end up paying for it anyway, because you have to go into emergency rooms, which is a very inefficient form of healthcare provision.
All right, thank you. So that brings us up to the part where our candidates we'll allow them 2 minutes to give a summation of their platform. Perhaps we follow up on questions or additional information they want to share with you to invite you to vote for them. Again, a reminder that this same bat channel, same bat place, will meet next week, and we have Representative 23rd District, Position 2. We have James Olson and Christine Rolls. Second thing is just a reminder, it's a you have to pay for your breakfasts, otherwise you'll be tackled out in the parking lot. And she's really good at it. She's really fast, if you notice her running around here. And with that, we started alphabetically. We started with the opening statements. For closing, I'd like to begin with Linda, please.
Well, my name again is Linda Simpson, and my whole goal for running for the legislature is to put it back to the people. Representative government of the people. I really believe that. So what do I want to be? I want to be the representative that listens to your concerns, that answers your emails, and answers my phone, so that you realize that I'm there truly to represent you. I'm not on my own agenda. I'm not on my own program. I'm there for the people. What do we all want? We all want the same America, the same opportunities, the same freedoms that we enjoyed as children. We want that for our families and for the future. So I really want the opportunity to work for our community, for the 35th Legislative District, for the state. Because if I'm elected, I might represent the 35th, but I will be the representative for every single person in our state. I'll be there to work for everybody, not just my district. So please, I would like your consideration. I would like your vote. Come November, please. My name is Linda Simpson. Thank you.
I think I'll just stand for this end part. Talk is cheap. Talk among political aspirants is particularly cheap at election time. I think and this format, which requires a 1-minute response, is conducive to sound bites. I think a more reflective way of looking at the candidates up here is look at what people have done in their lives and the successes that they've had in various areas. Just speaking for myself, I've been in business for 30 years and have been successful. I've taken my lumps. Not every decision that I've made has been correct, but over a long period of time I've done well. I've been president of the Boys and Girls Club during a difficult time and got that organization back funded well. I've been a founding member of that was a Big Brothers Big Sisters, a founding member of the Boys and Girls Club in Thurston County, on the Community College Foundation Board, on our local EDC board, a whole variety of different areas. I think you have to look at the totality of somebody's record rather than listening to the promises that they have to make. Thank you. And Fred Finn, I urge your support November 2nd.
So with that, let's give our brave